Afternoon. This is our 26th Digital Dispatches, and I'm delighted to have Gary Loughran here from HSC, and he's going to introduce some of our colleagues from FedIP. Today's topic is around developing the digital specialist workforce, something that's very prominent in our minds at the minute. I would ask you just to hold your questions to the end or put them in the chat and we'll pick those up. And if you can stay on mute just while we are having the presentations. So Gary, I'm going to hand over to you first.
As I was saying, my name's Gary Loughran and I'm working on establishing the HSCNI Digital Capacity and Capability Board, looking at the strategy for workforce development and digital capacity and capability. And today I'm joined by colleagues from the Federation of Information Professionals, Kim Bellis and Sarah Scrivener, who will talk through about items about the professionalism, how to join the register and what support it can offer you. My screen's being shared okay. And if I just walk through what we're going to look at today, the challenges to our workforce. Look, it's recognised everywhere that workforce challenges, and especially in health, are far and wide and need addressed. And to date, we've done a lot of really, really good things, but specifically in digital. And in digital, I mean not just our IT professionals or our data scientists and analysts. I mean our clinical professionals, who will also have to be supported in becoming a fully digital capable workforce. How we're proposing to strategically meet those challenges, and the formation of a capacity and capability board within HSCNI. And for those of you on the call, there'll be lots of activities. And if you want to get in touch with myself, and if you're interested in becoming someone who helps us deliver and supports the capacity and capability board in delivering initiatives, I'd be very welcome. So what are the challenges? So firstly, we need to recognise in our HSCNI strategy two things: our leadership and culture and our digital specialist workforce are both foundational enablers of the overall strategy. Without that good foundation, you can't build anything. Same as a house, or same with any architectural platform.
Just lost signal there.
So we do recognise that to realise our ambition and the strategic outcomes, we must invest in the leadership and culture and the development of our digital workforce, both professional, clinical professional, and our digital specialists. The challenges, and it challenges and more challenges. We've insufficient digital resource to meet the growing demand as dictated by the pace of digital transformation. We have lots of things going on. The formation of HSC Digital through the Evolve programme obviously encompass ICS, integrated care systems for Northern Ireland, which are being currently piloted in Southern Trust. We've NIPAX Plus, NILIMS, and a plethora of other digital programs. And the pace of that digital transformation is putting demands on our resource that we haven't got the capacity to meet. Our technology and innovation will continue to increase and change the way patients and staff perceive and understand and manage health. And with the likes of Encompass, which are bringing the public and patients into the conversation, we need to be very cognizant then of our own skills and the public skills in that conversation. These top 5 challenges for CIOs, they come directly from Gartner. And you'll see there the top 5 challenges for CIOs in government and public sector: digital skills gaps, lack of business resources, insufficient funding. They're all there, but in the top 3 of the top 4, or at least 2 of the top 5, sorry, are related to workforce and skills and professional development. From McKinsey, 70% of complex large-scale change programs don't reach their goals and fall short of their objectives. I think we're all probably pretty aware of that. And the hope being that a more enabled digital workforce for digital change, especially a lot of our change programs today in the health service in Northern Ireland and in the UK are based on digitization. Their foundation is in there in this internet era. So the getting a more complete and established professional digital workforce will help those goals. And look, 60% of organizations require enhanced IT capability in order to achieve success. And we'll see some more of that as we look at the progression of digital and digital capability. It's not going to slow down. Basically, where all this goes to is we are estimated to have a shortfall of 17,750 whole-time equivalents in England. This is a Health Education England report. And that shortfall probably prorates to about 800 staff in Northern Ireland, which nearly doubles our digital specific workforce, but also we have to incorporate in those clinical professionals. Of course, we have direct competition with the rest of the public sector. With our private sector, we have a shallow skills pipeline, generally speaking. Lower salaries in the public sector, as we're aware. And often candidates exploring digital information careers who are outside of HSE are not even familiar with the sector. So we need to brand ourselves better and market ourselves better. The approach we've chosen to meet these is, look, we've sectioned these, categorized these into 5 areas, and we'll see how we're going to deliver them. Service redesign. We need to recognize and professionalize people with technical and data skill sets. It's not just the stereotypical apathetical person with a beard and a heavy metal t-shirt in a back room. It's now frontline stuff. And we need to value that even if you're on a support desk, no matter what you do, if you touch anything, you're adding value to the overall experience and delivery of health and social care in Northern Ireland. And that needs to be recognised. Involve digital professionals in service pathway development. We're seeing that in Encompass and our electronic care record, NIPACs, our LIMS projects. They're starting to get really into that. So we're seeing that in Northern Ireland, and we need to keep working with it. And improve workforce planning. Better estimates of what we need when we need it and what's available. Supply and demand, basic skills, but we need to get on top of that and get a pipeline developed, which probably doesn't exist to the extent we would like it today. We need to transform our workforce, promote and enhance digital professionalism, and that's like professionalism is running through this whole capacity and capability. I think like a rock. So we need to look at that and obviously enhance it. Inline current and new and emerging job roles in structures across HSE, and there's a thing called, you might be aware of it, digital data and technical DDAT occupational framework, which is being developed, and hopefully the HSE Digital through the Evolve programme will start that process for staff in there, and we will all develop our own DDAT occupational frameworks within, and hopefully that gets recognised in the AFC structures. And again, professional development and education. Employer best practice, how can we change what we do? Promoting digital career awareness so that people are aware of what health social care can offer. Improve our recruitment and retention practices. We've seen some private sector practices having benches, being able to call on people. We don't have that luxury because it's hard to be agile at a fixed price in our health and social care business cases. But we need to look at what we can and can't do there. Improve the working environment, ways of working, professional values for digital staff. Again, it's about the value in what we do. And that value goes through the culture and behaviour of making sure the environment's right and the way we work is right for everyone in digital. Again, we're on the supply and demand, sustainable education development, closer working with our academic institutes and our leadership centre, ensuring that the development of programmes is current, refreshed, regularly reviewed, and is there to support career development in line with other professional accredited bodies and make sure we're keeping track with them. Closer work with education universities and external and internal workforce review, and that's back to our workforce planning. Leadership. Have we all got the right executive digital leadership? Is leadership in the conversation? I think if you're in a conversation around a table and you're the digital person at that table and someone says that's digital, that's not my problem, that's yours, I think that is a problem. It needs to not be like that. It needs to be embraced by everyone around the table as a cornerstone to how we can develop and deliver our services. And that starts at board level workshops and sessions, which we're trying to organise, which is executive level training, because culture usually starts at the top down and comes from the top down. That's where your culture and behaviours set. And if we embrace digital there, that'll flow through. And the creation of a trained pool of SROs to lead digital programmes and projects. So we're not always tapping the same person in the head, the shoulder to lead a programme or project who doesn't have the time to do it, quite frankly, anyway, at the minute. So we try to get a skill pool and maybe link that to career development as well. Moving on. we've developed a HSCNI or in the process of developing a capacity and capability board to help deliver these initiatives. You can see it here in the revised structure of the DHCNI governance. There's 2 new boards being created, but one of them, importantly for this session, is the Digital Capacity and Capability Board. And we do recognise that it is a foundation in our strategy again. So it's getting a place, and we're trying to establish, right beneath this is effectively the top management group. Performance and Transformation Executive Board is chaired by Peter May. Beneath that sits, for our digital world, the DHCNI board, and beneath that we now have 6 subordinate boards, and one of those will be a Digital Capacity and Capability Board. So it is as close to the top table in digital health and social care as we're going to get. The objectives of the board: make sure our workforce is commensurate to meet current and future demands. Make sure it's skilled and confident to work with and drive digital-enabled change. Every HSCN organisation is the right executive leadership, and establish professions and career paths for our professionals and accredit them and make them feel valued. All staff have the skills to respond and adopt new research, technology and digital innovations. And that means opening up our minds and embracing the academic institutes and other areas, and establish a sustainable HSC through the implementing the 5-tiered initiatives we talked about earlier. Hopefully those workforce challenges can be addressed through this capacity and capability board. And again, I'll reiterate to anyone who's here that I think if you want to volunteer to be part of this, I think it'll need HR skills, digital skills, people from clinical professions, and DHCNI leadership. And I think it'll need leadership from all the organisations if we get this right. But important in the first instance, getting our recruitment, our retention. So it'll be a lot of parallel work streams and things being done. So we will need people to populate those sub-level work streams and deliver the projects within them on behalf of this board. So anyone who wants to volunteer, please put your name forward after this. That has been a relatively quick shoot through of what we're doing in the realms of HSCNI digital capacity and capability and trying to develop our workforce. And it's try to introduce the concept. We're aware of the challenges. There are things being done. We've described how the 5 main areas we're addressing, both digital specialists and healthcare clinical professionals who have digital skills. And we are establishing a capacity and capability board to look at all that for us. And we'll have work streams set up under that. And it's not a quick fix. It'll take some time. And as you know, we have lots of economic pressures at the minute, not just in health in general, in our everyday lives. The economic environment here in terms of IT industry and the financial technology industry, fintech, is really, really strong at the minute. We need to keep a gauge in that, and we need to make sure we know what we're doing. And hopefully the formation of this board, the establishment of a better professionalism and looking at the academic relationships will help all of that. So look, without much further ado, thank you for listening to me. And I'd like to introduce you now and meet my colleagues from the Federation of Informatics Professionals, Kim Bellis and Sarah Scribner. I'll just hand over to you guys now.
Great, thank you, Gary, and thank you for inviting us here today. It's really nice to be able to come and speak to all of you. Kim's just bringing up the presentation, I think. So we just wanted to have a quick run through of who FedIP is, what we do, and most importantly, how we can help you as health informatics and professionals. So FedIP is a federation of 6 professional bodies. And between them, they represent most of the different sort of specialisms within health informatics. So we have AFA, who represent the analysts, BCS, which is the Chartered Institute for IT, so quite broad, CILIP, which is the Libraries and Information Association, so sort of knowledge management, along with IRIM, which are health records management, the Faculty of Clinical Informaticians, which is clinical informatics, and SOCATIM, which help us represent the social care area. So between those 6, there's quite a breadth of informatics specialisms represented between them. FedIP's aim is to bring those 6 professional bodies together so that the informatics profession has one voice. So instead of each of the professional bodies all trying to sort of put in their thinking all around similar topics, we thought it's best to bring them all together to have one really strong voice that we can represent the informatics profession better with. So broadly, our purpose is to professionalise the health and care informatics workforce in the UK, and we will achieve that through professional registration and bringing those various health and care informatics communities together. And our aim is to help people to maintain the highest standards of safety and protection for the public. So in essence, whilst our clinical colleagues, they're registered, they have their professional registration. When it comes to digital health and care informatics, we don't really have an equivalence in the same way. So FedIP has the professional register, which allows health and care informatics professionals to achieve that professional accreditation. So you can say to your colleagues, I'm professionally registered. Through that professional registration, I have to meet a certain standard. So you can be assured that my work meets the standards that you would want to see from a professional. And so the main aim of FedIP is to get as many of our health and care informatics professionals registered as possible. One, to maintain that level of safety and standards, but also so we can say to colleagues, and have a big voice in that space to say we are also registered professionals. We know what we're doing. These are our opinions on X, Y, and Z. So the way that we run that registration is we have different FedIP standards and different levels of professionalisation. So I'm just going to hand over to Kim, who will walk you through all of the different FedIP levels and what those entail.
Thank you, Sarah, and hello everybody, my name's Kim. So the standards, we've got 5 levels. So we've got associate practitioner, practitioner, senior practitioner, advanced practitioner and a leading practitioner. And they each have different levels to them. And it's mainly around the autonomy that you have. So an associate practitioner, you have limited autonomy. You're working under supervision with limited discretion. A practitioner exercises autonomy subject to overall guidance and direction. The senior practitioner exercises autonomy within limited parameters and may have responsibility for the work of others, often doing complex non-routine technical professional activities. The advanced practitioner exercises autonomy within broad but well-defined parameters, and they build appropriate and effective business relationships, and they perform a range of complex technical and professional work. We've got the leading practitioner then, and they exercise autonomy within broad parameters, and they have authority over all aspects of a significant area of work. So your CIOs would be registered as leading practitioners, and others in sort of senior management structure within an organisation. They address complex, non-routine organisational problems, and they have a full range of strategic leadership and management skills. So those are our 5 levels. How do you get registered at those levels? Well, first of all, you have to join a professional body, and Sarah's already spoken about those 6. I'm going to talk to you specifically about the Institute of Health Records and Information Management because I belong to that professional body. So if you were to join IRIM, we would automatically give you an associate practitioner level if you weren't coming in as a student. If you were coming in as a student and taking exams, we would hold that then until you'd achieve those exams. But if you're just coming in wanting to be a member of IRIM, you automatically go on to the public register as an associate practitioner. If you then decide to go on to do your exams in either health informatics or our national clinical coding qualification, once you attain those, we then automatically give you practitioner level on the public register. If, however, you're, I don't know, maybe you're a senior manager and you want to join IRIM, and you actually think, well, do you know, I think I'm an advanced practitioner. I don't think I should be coming in as an associate practitioner. Then there's room for a conversation with us. And we would then talk you through the different evidence that you would need to produce to be awarded advanced practitioner on the register. And we support and help you with that. Gary? No, he hasn't got his hand up. Okay, just checking. So we would have a conversation with you, and we would help and support you attain that level. So if you'd filled in your application and you'd come in and we didn't think you'd quite met it, we would give you that feedback and invite you to give us some more evidence for that. So that's how you would become on the FedIP register through IRIM. Obviously, the other professional bodies have a different mechanism for you to get onto the public register. Just wanted to talk to you about the different levels. So each of the levels has 9 parameters within it that we expect you to meet. So I'm just going to talk to you about the leading practitioner standard. So in the first column, if you look at P1, this is about researching and developing standards and best practice, identifying emerging methods, tools and technique, developing strategies for implementation, and developing quality improvement initiatives. And on the other side, we provide you with some guidance then about the different types of things that we'd be looking for. So tell us about your research and development of standards and best practice. How have you identified emerging tools, methods and technologies? How have you developed strategies for implementation? And what have been the results of your research and quality improvement? So we take you through all of those different levels, and that also goes for you know, the associate, the leading, advanced, and the other 2 as well. We always ask you in P8 to comply with the code of conduct of your institution or professional body. So we would expect you to know what the codes of conduct are. Describe the situations in which compliance with them applies to your role as a leader within your organisation. How have you ensured that you've maintained compliance with the code of conduct? And what have been the results of compliance? And then we also talk about CPD. To stay on the FedIP register, we ask that you do 10 hours of CPD each year. And Sarah's going to show you how, I'm hoping she's going to show you how that you can record that in the hub, because it's a really good resource for people to use. So as I say, these are the different bits of evidence that we would expect to have from you if you were wanting to join at a leading practitioner level. So this is what the public register actually looks like. I'm not breaching any confidentiality here because this is a public register, so people have agreed to be on there. You don't have to be, it is completely your choice. But why wouldn't you shout loud and proud about the, you know, you've reached this level and you want everybody to know about it. So if you decide to have your name on the register, it serves many purposes. You're telling everyone that you are a registered professional. Look at me, I've attained this level. And it may be, if you do interviews, let's say, somebody has said I'm on the FedIP register. You might want to check that ahead of an interview, maybe. Also, your peers and colleagues can see that you've achieved professional registration. And it aligns us to nurses and doctors who have to demonstrate their fitness to practice. Why shouldn't health informatics professionals have to demonstrate their fitness to practice as well? So that's the public register. And I'm now going to hand back to Sarah.
Thanks, Kim. So just to slightly follow on from what Kim said in terms of the other professional bodies and going through them for registration. So whilst they all have slightly different processes, they are all essentially the same in that they all pull from that standard. So for any professional body, what you essentially need to do is download the form in whatever way their professional body is doing it, but download their form, select which standard, which level you're going to apply for, and then provide evidence to how you meet that standard. So that, in essence, is how you apply to become FedIP registered. If you say different professional bodies go about it in slightly different ways, but in essence, that's what you need to do to become registered. So as Kim said, one of the benefits of being registered is that sort of parity of esteem that, with clinicians, you're on the register, you can prove that you have a certain level of expertise. So that's a really big benefit as far as we're concerned. But the main question that I often get asked is, well, why should I become FedIP? Why should I become FedIP registered? I'm very busy, I've got a lot of other things to do, which is a fair enough question. So first, obviously, you do have that professional registration. We do provide digital credentials as well, which I find really helpful. So instead of just having your post-nominal letters, which you also get with FedIP registration, we also have a digital credential through Credly, which gives you a digital badge that you could put, for example, on your LinkedIn or in your email signature. And when you click through to that badge, it will actually display all of the criteria that you've met to achieve it. So people can investigate a little bit further what you've actually done to become a leading practitioner, for example, which is really helpful. We also have the FedIP Learning Hub, which Kim alluded to earlier. So we do have this requirement of doing CPD in order to maintain your registration. However, we didn't just want to put that requirement in place, but then not actually provide any CPD. So the FedIP Hub is where we store our CPD and all of our learning that health and care informatics professionals can go and do their CPD on there. We have things from all of the professional bodies on there, so from BCS through to IRIM, which is quite useful, I think, because sometimes there is a lot of sort of interdependencies between the different sort of professions. So I was saying to these guys earlier that we ran a webinar not too long ago on clinical coding, and we actually had a lot of interest from doctors and nurses who came to that, which we weren't necessarily expecting. So it's nice to have that ability to be able to dive into different subjects, maybe a little bit outside of your own, just to see how they all connect together. So that's a really great benefit of the hub, as well as doing your CPD accredited training on there. So there's lots of resources, not only from the professional bodies, but we also have resources from the University of Edinburgh, for example. So they've provided us with courses on R programming, data ethics, data visualization, lots of different bits and pieces. So there's a really good wealth of information on there, which is available to FedIP registered practitioners. But we do offer a 6-month free trial, just so people can go and see if it would be of use to them. So if that sounds interesting to you, you might want to go to the FedIP website and just have a little look to see if there's anything of interest on there for you. The other great thing about the hub is that it has a CPD recording tool on there. So when you complete CPD on the hub, it automatically records it for you. So instead of you having to sit down and write, the title and description and how many hours it was, it just automatically records and saves all of that for you. And if you've done CPD sort of externally, you can also just add that to your CPD record. So you can keep it all in one place, which is quite useful. But should you need to sort of, take it to an employer, for example, to evidence something, you can download it all from the hub. So it's not stuck on there. You can download it into a CSV file, and it will download all of the evidence you've uploaded as well. So it's just a really handy tool to keep track of all of your CPD in one place as well. And it has the forum on there, which is the online community. So if you have some questions you're looking for someone who is a qualified practitioner, so they've evidenced that they know what they're doing because they've become FedIP registered, you can ask questions within that forum. So it's just nice to have that bit of community on there as well. So those are sort of the main benefits of becoming FedIP registered. I think we have a little bit of time as well to talk about some of the work that FedIP is doing, which we hope would be useful to you as practitioners. So I'll leave Kim to go on to the next slide, which I hope is the next slide. That's just the FedIP Hub address there, but we'll give you the slides after for you to go have a look.
Okay, so we'll talk to you a little bit about the occupational architecture, the professional development work that we're doing. So this is around, Gary's already alluded to the fact about DDAT. So these are 77 of the roles that were taken from the government DDAT job profiles. And FedIP commissioned BCS to do a piece of work for us to take these job profiles and also then to map them to SOPHIA, which is the skills framework for the information age. So piece of work that they've done, they've taken the IT operations and they've taken the technical job profiles. Sarah, I think you've already uploaded the IT operations, haven't you? Into
They'll be available from Tuesday.
Excellent, lovely. So they'll be available from Tuesday. Those roles, so that's 77 roles. We've identified a further 10 during the work that that BCS did. Obviously, there's loads more job roles that we know that we've got to look at. So AI is one of them, information governance, or the cyber is another group that we're looking at as well. So those that are on there at the moment, the IT operations have already been out for one round of reviews. So some key individuals were asked to review those job descriptions, give feedback. They've been updated, and that's what's available for you on the FedIP website. The technical roles, which Sarah will be uploading over the next couple of weeks, they haven't been through a review yet, but we are inviting you to go on and have a look and give us any feedback that you feel that you think is missing from those job profiles. The same would apply to the IT operations as well. Although it's been through one round of review, if you read them and you think, actually, I think this is missing, we're going to be uploading a form that you can fill in that will give us that feedback, and we'll look to work with BCS and update those profiles. So just to give you a quick preview of what they'll look like. So they're broken down into maybe about 7 different levels. So you start off with the background. So that gives you, so this is for the IT operations service desk analyst. So that will give you a breakdown of what the job role is. You'll also have a one on there about work activities, and you can see at the end that there's a code, and those are the codes that link back to the SOPHIA mapping that BCS have done. There's also one on there around knowledge and skills. There'll be one on there about qualifications, and then at the bottom of that you'll then see the DDAT part of this. So that's what we're doing in terms of the job profiles, and as I say, we are starting to work with other areas. So cyber is one that we're currently working with, and information governance. So job profiles will look fairly similar, I would say. So you'll be able to take that then and decide how you want to use that. And it might be that you're looking to advertise for a new role, and you'll be able to take this and you'll be able to pick and choose. You don't have to take the whole profile. You can take bits out that relay to the job that you're looking at. You might want to use these in organisational change, maybe. So again, the detail that's in here, you'll be able to pull out and use. So we think it's going to be really, really helpful for people. I guess the one big thing, and I don't know whether you use Agenda for Change. Do you use Agenda for Change? Yeah, okay. So the one big question is how does this align to the Agenda for Change framework? It doesn't at the moment. We've started some very early conversations with the NHS employers section. They know that this work is going on. We know that this is missing, the whole health informatics bit is missing out of the Agenda for Change framework. So they are aware of that. Any change with Agenda for Change, though, is likely to take 18 months to 2 years. So don't expect to see something overnight. What we are going to try and do, though, is get an Agenda for Change panel together from experienced panel matchers, take some of these profiles and see if we can put some indicative bandings next to it, so that when you go back to your individual HR departments, you've got some sort of ammunition, if you like, to go to them with and say, well, actually, the Federation for Health Informatics has given an indicative banding of this. So it will give them somewhere to start within your organisation. I don't think there's an awful lot more that we can say on that, unless, Sarah, you can think of anything that you want to add.
No, as Kim said, the IT operations roles, so I finished uploading them into the FedIP hub. So when you go in there, it's quite clear. When you come to the dashboard, there's something called job descriptions. When you click through to there, that will bring up all of the IT operational roles that are currently on there. I'm basically just spell checking the last ones that are going through, so they should all be set to go live on Tuesday, and then the technical role should come through sometime later next week. So when you click on each individual role, that will bring up the document sort of as you see it on the screen with all of that information in it. And then underneath that, there will be a feedback form. So as you're looking through the document, if you think, I think actually this requires this training, but it's not in the document, or actually I think this is a really fundamental skill that you need to do this job and I don't see that represented, we're really open to feedback. As you can imagine, you know, in digital, things are changing all the time, so we certainly don't want this catalogue of job roles to be static and just be something we've done and then left and it's never been updated. It is going to be updated on a fairly continuous basis. The method of which we'll be doing that by is primarily through the professional bodies giving their expertise on each of their specialist areas. But of course, we want to hear back from organisations that are actually using these, because we want them to be as useful as possible. The feedback that we sort of had prior to this work, we did a nationwide consultation, I think it was about 2 years ago now, with Wales, Northern Ireland, Scotland and England NHS, to ask people what they wanted. And so this is sort of the result of that feedback of people saying, well, there's just very little sort of unity. Different job titles come with different job descriptions, or you might even have the same job description but with like 16 different titles, but it is in fact the same thing. So we're hoping that this work will just provide some clarity across organisations, and then the sort of next step of that will be leading into sort of careers frameworks and career pathways. Because of course, if you don't have a set of unified sort of job descriptions, if someone says, okay, well, this is my job currently, what is the next step? You know, should you want to take it? Well, if no one's got sort of a unified job role or job description, you don't really know what necessarily the next step is. So that goes even to, you know, right back to, you know, sort of apprentices and people come out of university. We want to say to them, you know, come work in the NHS. It's a really great place to work. This is the career path. This is what we can offer you. This is, you know, where you're going. So although it's early days with this, obviously there's a lot of work to do. DDAT's quite a wide sort of breadth of roles. We're hoping that this foundational work will be useful in and of itself, but will eventually lead into, as Kim said, maybe looking for an agenda for change, looking at sort of careers pathways and early careers sort of things as well. So early days, but some really good foundational work we think that's going in at the moment, and we'd be very open to your feedback. We hope it will be useful to you. So I hope you go and take a little look at it on the hub when it's up on Tuesday, and see what you think about it.
So happy to take some questions. I know we've got quite a bit of time. I don't know how Sarah feels about giving you a quick whiz around the hub so that you can actually see what it looks like and where to find things. Would that be helpful?
I can do that if that's okay with everyone.
Is that all right, Gary? Are you happy if we do that?
Yeah, absolutely. I think showing people what they can get from PetIP in that regard, I think is very helpful.
Okay. Shall I stop sharing my screen, Sarah? Yeah.
Yeah, if I just.
Well, while you're
Any-
transitioning over to that, can I ask a couple of questions?
Yeah, certainly.
I've 3 in my back pocket. 1, is this internationally recognised?
The
2,
theories.
right, okay. 2, what are the costs associated, and is it like a tiered cost as you work through the different stages? And 1 for Gary, do you see this as becoming an essential criteria going forward for future roles in HSC?
So shall I pick up that first one? So yes, the Sophia is international. And as we speak, Andrew, the CEO of PetIP, is in Australia at the moment at their digital conference, specifically to go over there and have a chat with them. They've got this really, really whizzy piece of kit that is maps the career pathways. And what it does is you say, I am this and I would like to be this. Show me the skills gaps that I've got, and it will tell you the skills gaps. And then our thought then is that it will then take you to the various different courses or qualifications that you will need to do to meet the criteria. So he's gone over to have a chat about that. So absolutely, we're looking at trying to make this an international thing, so that we can do cross borders. I mean, people don't stay in one place, do they? So from that point of view, absolutely. Cost, it's £25 to go onto the register, and that's each year. You have to do your 10 hours of CPD, but £25 at the moment, and it doesn't matter what level that you're at.
Linda, thank you, Kim. In terms of being an essential or mandatory criteria, I think that's what we would like to get towards and very desirable. And I think it's part of the valuing the profession element. If we look around even within BSO or health and social care space, our professionals are all accredited, do CPD, our accountants, legal teams, procurement, get CIPD, and so on and so forth. And within what is a growing profession of 1,000 strong people in BSO and beyond, we don't have that accreditation or professionalism. And I think that's something we need to strive to attain, even if it becomes desirable or mandatory to attain an element of within X amount of time of joining or within taking a job. There's things we're looking at, but that absolutely would be where we aim to get to. And hopefully that will be embraced and not, embraced as something that as a profession is elevating what it is to be digital or a techie or however you're perceived or perceive yourself.
Okay, thank you. Hey, Sarah, we'll hand over to you to do your virtual tour.
Thank you. So this is the PetIP Hub dashboard. So when you log into the hub, this is what comes up. So I'll just take you through a few interesting points of it. So the catalogue is where you click through to see absolutely everything we have. So as I said, there's a few different bits and pieces. So from BCS, for example, artificial intelligence, I think, is one of the most popular ones at the moment. It's the buzzy one that everyone's into. So lots of different things from BCS. You've got the University of Edinburgh ones there. If you are a member of BCS, for example, we have webinars to take you through how to become registered with PetIP through BCS, and we have one for CILIP as well on there. We have all of the back catalogue of all of the Faculty of Clinical Informatics past webinars, which are definitely worth a watch. How to become a clinical informatician is quite a popular one, I think, which was interesting. So lots of different things that you can look at in the catalogue. When you sign up for the hub, we do ask what your sort of general job role is and if you're a member of a professional body. We do this because this creates My Learning. So obviously when you go into the catalogue, that's kind of everything, which is perhaps a little bit overwhelming. So we also have My Learning, which will pick up anything in your profile. So say that yes, I'm a member of AFA and I'm a data analyst. And then so your My Learning will show you specifically things tailored to that profile. So you don't have to trawl through the whole catalogue. You can just look straight at the things that are of interest to you. They're a bit of a random collection on My Learning because I do everything as a little demo for myself, but it will be tailored specifically to you. So the thing that I think is really great about the hub is this CPD recording tool. So as I said, when you do CPD on the hub, it will automatically record it in your CPD recording area here. Obviously, I've been very lax and mine's not showing anything at the moment, but we don't have a particular submission deadline. You can create your own because we appreciate that obviously different people have different periods of time in which they need to do CPD. And you can also, well, we have it set to 10 hours. If actually you need to do more hours as part of your particular training or particular professional body, you can set it to more hours if you want. So all you need to do is just add your period. So when you want to start and when you want to finish, so it might be January to January, but it might be different. You can put your target hours in there as well, and that will create this page for you. So you can, when you log in, you can see quickly how many hours you've completed and how long you've got yet to do it. You can manually add entries. So this is the information that we ask for, fairly standard for what you'd want for CPD, sort of the title, what type of learning it was, what activity type, which is different based on what you've chosen. So let's say CPD, attending conferences, description, the date you completed it and the time it took. We also have reflective statements here. So AFA, for example, require reflective statements to renew their registration. So we have that in there, and you can upload any evidence, you know, certificates or what have you to prove what you've done. You can save it as draft, so you can do it and come back to it, or do it all in one go. It's up to you. It'll tell me off because I've not saved it. There we go. So that will, where you have the title here, that will just be a list of all the CPD that you've done. As I said, it will automatically add it if you've done it on the hub, but you can manually add it as well. So that's just quite a useful tool just to make CPD recording a little bit easier for everyone. So I said the job description database will live in here. It's a bit blank at the moment, but on Tuesday it will be full of IT operational roles. I can just show you quickly, actually, if you might have spotted one in. So this is Associate Application Operations Engineer, which is a nice long title. So this is how it will look essentially when you click through into it. So this is a very super sneak preview because it's not live yet. So it will just give you a quick summary of which job family, which family description, and which job role you're looking at. When you click into here, that will bring up the PDF that contains everything Kim showed you earlier in that slide. So a summary, the knowledge skills components, the training activity components, qualifications, organisational skills, loads of information in there. And then once you've opened it and read it, if you do want to submit that feedback, it's really easy. Just open the form here, fill it in, hopefully, and then you can upload it, just submit job role feedback form here. So you can do it all within the system. You don't have to like email us or anything. If you don't want to, you can just download it and re-upload it all in the same place, which we hope makes giving the feedback a little bit easier. But that's essentially how it will all look. And that will all be populated in this section here. So instead of just the one, you'll have them all. They are all color coded to try and make it a little bit easier for you by job family, so it won't look too overwhelming. But that's essentially how that will look. And there's the discussion forum. Let's see if that I'm always conscious when it opens in a different tab where it's going to stop sharing the screen, but I think that's worked. So this is our forum. They're locked to different things, and so different FedIP levels, just so you know when you're talking to someone who is a registered practitioner. But we do have open sections for people who are like on the 6-month trial, you know, just to start sort of conversations. And we have just different specialist groups. So the 35 under 35s are our now called Future Digital Leaders. So they're just a group of people who are early in their careers, just to give them a little space to get together more informally as a bit of a community. So different spaces will appear based on your profile, but it's just a nice little community space that we have on there as well. So that's sort of a very flying tour through the hub. There's, as you can see from the catalogue, there's quite a fair amount of training on there for you to go through. So I hope that there would be something of interest for you on there. As I said, you can go to the FedIP website just to create an account, and it's free for 6 months. After 6 months, we do ask that you become professionally registered, but we wanted to give everyone a bit of a look on there sort of before they commit, if you like, just to see if it's going to be of use for them. So I hope that's a useful thing to have shown you. But we wanted to provide you with a way of actually doing your CPD, because one of the feedbacks we had was, well, I know I should do CPD, but I just don't know where to go to get it. So we are hoping that this provides you an easy place to go and an easy place to record it as well and keep it all together, rather than just putting it in a little notebook, which is, I have to admit, what I've been doing for quite a while before this came along. So hopefully that's a useful tool, and I'll stop sharing my screen so I can see you again. I don't know if there are any questions around the hub at all, or indeed anything else before we wrap up.
Claire's just asked in the chat if anybody that's on the call has actually used the hub before. No, nobody's been hands-on by the sounds of things.
I have.
Well, I would hope so, Kim.
I've started my CPD on there, and if I can do it, I'm telling you, anybody can do it. It's really straightforward.
I have to say, I will be going on to log on, because that is something I always struggle with, is the recording of it. And just from that flash tour, Sarah, I've seen a couple of topics already that I wouldn't mind going in and having a look at. So if I've been inspired, I'm sure others will be whenever they see the video later. So thank you so much for taking the time on a Friday afternoon to give us a whistle-tops tour of the benefits of joining. It's all well and good us hearing from Gary about it, but I think actually hearing it from you definitely gives it a different slant. I, for one, am delighted to see the job descriptions, because anytime we go to recruit, we go to our HR team and they always struggle because their reference point is Agenda for Change. So that would definitely be a great linkage if we could get it, even if it would be worth waiting the 18 months to get it and get it right. So again, thank you very much for joining us today. Next month, we are here on the 4th of August, 1 p.m. So I'm hoping to see more faces and more participants again next week. Thank you.
Okay, bye-bye, everybody.
Thank you. Bye-bye.
Bye.
Bye.
Bye all. Thank you.